First, I'll describe myself and my setting. I'm a middle-aged menopausal white woman with brown hair tied up, wearing black, and I'm sitting in my office at home with bookcases behind me and to my left. My research is on access to healthcare for autistic people, both to primary healthcare and also experiences in the mental health services. But as I said, today I want to focus specifically on the non-binary group, because we know that non-binary people are overrepresented in the autistic community and may face additional barriers to healthcare. Next, some trigger warnings. We know from several large studies that we experience worse physical and mental health than non-autistic people. And so if you haven't heard about our healthcare outcomes and our mortality statistics, including our suicide risks, this could be upsetting, particularly if you're autistic or a parent. So it's important to remember that any figures I'll give relate to the autistic community, the population as a whole, do not indicate individual outcomes. And I would ask that you would please take whatever steps you need to protect yourself, including stepping away and coming back to my talk or not at a later stage. I will mention suicide, self-harm, as well as physical and mental health issues. It's also important to say that I may reignite the intense emotions many of us are feeling because of current events in the autism research world, which are deeply impacting our community. But before moving on to issues in primary care, I want to briefly mention some preliminary findings from an ongoing study of the experiences of autistic adults accessing mental health services. Here we used a mixed methods approach to survey autistic adults attending Autistic, which many of you will know is a residential conference organised by and for autistic people held annually in the UK. And this study was undertaken in 2019, which was the last in-person Autistic. We received 101 responses, 23 of whom identified as non-binary. And 9 of our participants didn't respond to that question. And I want to address that in a few minutes when I move on to the second study. But the suicide data in this cohort is frightening. How have we reached a situation where we as a community are so marginalized and so misunderstood that 86% of a group of autistic adults have considered suicide? 47% had attempted suicide at some point. 65% had engaged in self-harm, which is not something that's widely known amongst healthcare providers. And for 21%, this required medical attention. And I know that few of my colleagues treating patients following an episode of self-harm would think of would think of autism. 27% had been psychiatric inpatients, 11% had been detained under the mental health legislation, with 10% experiencing restraint. 28% used alcohol to manage mental health issues, with 11% using illicit drugs. This is the poster of the project presented recently at INSAR, which gives a little bit more detail, including where autistic adults turn to for help when in mental health crisis. And looking more closely at this, the positive axis shows where autistic adults seek support for mental health challenges, and the negative axis shows where they do not. And it's striking the number who would not seek help when required from psychiatrists, mental health services, or emergency departments. We expect the ongoing qualitative analysis will shine some light on the reasons for this. And while most of us are familiar with the mental health challenges, the mortality gap and the physical health challenges associated with autism are less well known. This seminal paper by Hervikoski et al. Looked at all-cause and cause-specific mortality in a large population and showed that the mortality rate in the autistic group was 2.5 times that of the general population. Other studies show similar outcomes. And there is even a recent paper showing that even our in-hospital mortality rate is doubled. Here's some more details from the Hervikoski paper, which I'll skip over, except to say that the leading causes of death in the autistic group were heart disease, suicide, and epilepsy. But in almost all diagnostic categories, including cancer, lung disease, and endocrine disease, mortality rates for autistic people were increased, except for infections, which is interesting in the context of the current COVID crisis. But autistic people experience higher rates of many physical conditions, and it's known that we face healthcare inequalities and access barriers, and in particular, prior negative experiences with healthcare providers is an independent barrier to future care. So my work in this area started as a quality improvement project around autism training for healthcare providers. So back in 2018, I undertook a survey, also at Autistic, asking, what do you wish your GP knew about autism? And the results of this survey were used to make an online survey, which compared the experiences of autistic adults, the parents of autistic children, and non-autistic controls. And our paper is currently in review. And while we don't have time to go through the results in detail, a preprint is available on medRxiv. Now, the majority of our 860 respondents were autistic, with 74% of those having a formal diagnosis. Looking at gender, the vast majority of responses across all three groups were from those identifying as women. And the proportion of the autistic group identifying as non-binary was 18%. So that's the purple. And 2% preferred not to say. 5% of the non-autistic group identified as non-binary, and none of the parents. Now, I have to say the charts I'm using today were based on a prior preliminary analysis, and I haven't managed to update them. So some of you may notice that the proportions are slightly off compared to the figures I've given. But I have to say that's just because I've been completely derailed by the recent events, which have just dominated the lives of so many of us this past fortnight. The gender categories that I used were male, female, non-binary, and prefer not to say was the fourth option. And therefore I want to address the non-inclusive nature of my past work in terms of gender identity. I could simply mention it as a limitation, but I believe when past autism research is later recognized to be harmful, however well-intentioned it may have been at the time, then an acknowledgement is warranted alongside a sincere apology. At the start of my research journey, I was not well informed about gender diversity, and I would do this very differently now. So I just want to apologize to my study participants, to those potential participants who felt excluded from my work, and indeed to those of you who may be triggered by this now, in particular those who are trans or indeed any other gender identity. Only in recognizing past harms can we move forward in a spirit of collaboration and trust. Moving on to some of the results. We asked, do you have difficulty visiting your doctor when you need to? Not in general, but when a visit is actually needed. And over 3/4 of the autistic group, half of the parents and 1/3 of the controls said yes, they had difficulty. 78% of our autistic respondents avoid using the phone in general. And this was the most common barrier to accessing healthcare. Again, it's not something that's widely appreciated outside of some autism-specific services, and it is one of the most urgent areas to address. So if a service relies on telephone contact and doesn't offer an alternative, that service may be inaccessible to a majority of autistic people. 55% do not attend because of not feeling understood. Sensory issues, executive functioning issues, and concerns around disclosure also featured prominently. I'm going to skip through most of the details in the interest of time, but they're here for anybody who wants to pause for detail. And just to be clear, the autistic group is in pink. But here, just look at the intergroup differences for none of the above. The difficulties that we face in managing to arrange and attend a medical appointment are simply not experienced by non-autistic people, and therefore they're often not understood. 90% of autistic respondents had difficulty communicating in a consultation, either all the time, frequently, or sometimes. And looking specifically at the non-binary group, the communication challenges were increased for the non-binary group, who were equally likely to avoid all the same communication methods, but even less likely to use the telephone in general, and more likely to use an augmentative and alternative communication device. Verbal communication was more likely to be described as difficult by non-binary participants, and sensory challenges were more likely to exacerbate communication difficulties. Difficulties describing pain or other symptoms were also increased in this group. Non-binary participants had more difficulties using the phone specifically to make an appointment, communicating with the reception staff, and also with the waiting room environment. And were also more likely to need to attend with a parent, partner, or support person than alone, and more likely to attend for mental health difficulties. Compared to male or female autistic respondents, the non-binary group were less likely to consider their GP knowledgeable about physical or mental health conditions, although they rated the GP's autism awareness equally poorly. Lack of autism awareness was a recurring theme throughout both studies, including how it can present atypically, particularly in women, girls, and gender non-conforming people. Another participant described their psychiatrist as perfect if only she knew about the autistic experience and world. Other differences for the non-binary group included increased mobility needs, a greater need to email in advance, the reason for the consultation, which may reflect the greater communication difficulties, also a need for extra processing time and a specific difficulty with unexpected touch. The consequences of inaccessible healthcare are starkly illustrated in this table, and all are statistically significant. But when we looked at the consequences according to difficulty accessing healthcare, they were very strongly correlated. 2/3 have had both physical and mental health conditions remain untreated because of inability to access healthcare. Half were referred to a specialist but didn't attend, and almost 2 in 3 were told that they should have seen a doctor sooner. Over 1/3 had to undergo more extensive treatment or surgery than if they had attended sooner. And of greatest concern is the 32% who didn't seek treatment for a potentially serious or life-threatening condition. Now that's from the entire data set, but when we looked specifically at the non-binary group, they were maybe more likely to have both mental and physical health conditions remain untreated, but worryingly, were significantly more likely to have a potentially serious or life-threatening condition remain untreated. So both of my studies show a worryingly high rate of autistic people not registered with any GP. The greatest barrier for many is the phone. And so I'm particularly concerned about our community during the COVID with the move to telehealth. And non-binary autistic people face even greater challenges accessing healthcare. Increased autism awareness and understanding is the greatest need, along with communication and environmental accommodations. And this is a matter of human rights, because equality legislation requires that accommodations be made. So, for example, failing to provide an alternative to the use of the phone to access services is potentially a breach of duty under that act. But it's not just a legal requirement, it's a moral duty. We would never deny a wheelchair user access to healthcare services for want of a lift or a ramp. And accessible communication alternatives to the phone are equally important. Our greatest need is for a national network of autism competent GPs. So education and training is required for all staff in both physical and mental health care. And this must be informed by the lived experience of autistic adults. And it's ideally developed and delivered by autistic healthcare providers. So we need to challenge the assumption within the profession that autistic people are our patients or our clients, and recognize that autistic people number among our colleagues. Because making healthcare services autism friendly involves first recognizing, valuing, and learning from our autistic colleagues. More than anything, it's vital that we accelerate the move towards a strengths-based approach to autism and resist the tragedy narrative that is so pervasive across healthcare. Understanding our autistic patients is not intuitive for non-autistic healthcare providers, but is so important in order to facilitate access to services and to improve outcomes for autistic community members. My autistic doctor colleagues and I are working together to raise awareness within the profession, conference papers, journal articles, educational workshops, where we aim to present a neurodiversity affirmative approach to autism, inclusive of all autistic people, which we hope will ultimately translate to an improved healthcare outcomes for all members of our autistic community. And I'll leave it there. Thank you.